We're trying to reduce all the harms that we can.
You got it.
There is a lot to lug.
All right.
But they are always set up in time for lunch.
Feed them and they will come. Do you see that car? That car up there, that's where we're going. That car and that pecan tree. We are in the English Avenue community. On the streets, this is known as the Bluff.
There's 2 doses in here.
Atlanta Harm Reduction Coalition does this several times a week, goes into vulnerable communities.
You see that? So that goes right in the nose.
All right, 1, 2, 3, 4, 5, 6, 7, 8, get you 11. This is where outsiders know to come and buy drugs.
Do you need any condoms or naloxone?
Georgia's legislature voted to pass a bill legalizing syringe exchange in Georgia in 2019.
41.
The coalition has been doing it much longer, for 25 years.
67, 68, 69.
A steady stream of people come to eat,
It's a 3-course meal, dang.
to exchange their used needles for new ones,
8 in, 11 out.
to get the overdose reversing drug naloxone, or to be tested for HIV or hepatitis C. Harm Reduction co-founder Mona Bennett.
A judgment-free zone is vital. The people we serve are treated like crap almost everywhere else.
39 states now have syringe exchange programs. Many passed after what happened in Scott, Indiana.
In southern Indiana, made national headlines.
A rural area hit by the opioid crisis.
It tore through the community.
Among its 4,000 residents, 231 of them wound up with HIV from sharing needles. Almost 6% of the population.
It's gotten a lot better.
Drug use is still rampant, but syringe exchange helps stop the spread of HIV. And that is the foundation of harm reduction, reducing harm to the individual and harm to the broader public. Harm reduction also helps people into recovery.
We have had a lot of people come to us. Mona, I'm ready. 1, I'm ready to quit. 3, harm reduction is a bridge to treatment.
We didn't get into this crisis overnight, so it's going to take a while to dig out of it.
A lot of people served by Atlanta Harm Reduction Coalition are uninsured, making access to treatment difficult.
I think that is something that
Cassandra Price is the director of the Office of Addictive Disease at the Georgia Department of Behavioral Health and Developmental Disabilities.
we're expanding treatment services to help them reach a state of recovery.
The state of Georgia has expanded from just 2 medication-assisted treatment programs for the uninsured to 21 since 2017. $4 million in state funding, in addition to federal funds, has increased the number of addiction recovery support centers across the state to 25. Approximately 2,000 Georgians have been treated using MAT thus far. The issue of stigma remains a problem, and this is part of the state's effort to change that.
Think about it, 20 years ago, would you have seen someone in recovery on a billboard, loud and proud?
Billboards throughout the state showing people in recovery from substance use disorder, putting a face on this crisis.
We want people to know that there's hope. This crisis is awful. We used our funding to get peer support focused on individuals who have lived experience using medications from opioid use.
I have to reach for the stars. That's right.
The state also works with nonprofits like the Georgia Council on Substance Abuse. 650 people in recovery throughout the state have been trained to be peer specialists, people who support other people working toward recovery.
We need more treatment in Georgia, am I right?
This weekend, the training is happening in the English Avenue neighborhood.
Number of people
Council Executive Director Neil Campbell.
Between 3 and 4 people a day are dying. A day. Wow. If it was Ebola, what would we be doing?
Be a national crisis.
Be a national crisis, we'd be figuring it out pretty quickly.
So let me ask you, what have we done well?
I'm a certified peer specialist.
Tony Sanchez has that lived experience, hard-lived.
So I come from a family of entrepreneurs.
Sanchez means drug dealers. Raised in the Bronx, he was addicted to opioids and is unflinching in sharing what he did to answer the cravings from his addiction.
I know what it feels like to leave my wife in the hospital when she's about to have surgery and go home and steal all her medications and either sell them in the street or use them myself. You know what I mean? I know what it feels like to spend more time in jails and in prisons, to the point that I thought that I belonged there and I didn't know how to function. I know what it feels like to come home and seeing all the pictures on the wall, and I'm not in any of those pictures.
In recovery for decades and living in Georgia, this home-owning married grandfather has lost track of how many people he has helped as a peer specialist. But within his own family, the losses continue.
My first cousin passed away in August of last year. My brother-in-law just died in September. My brother, he just told me that he overdosed in July, but they were able to bring him back Narcan, and because of stigma and shame, he didn't want to talk about it.
Sanchez is leading this event in Macon on mental health. He works for the state of Georgia, making his living fighting against the very disease that almost claimed his own life.
I'm the director of the Office of Recovery Transformation, a state job with a director's position, and I am a returned citizen. I spent so much time in prison, and they know, and they still pay me. My house is paid for. I'm a taxpayer. I'm a father. I'm a grandfather. I'm a business owner. I'm a member of my church. I'm a productive member of my community. I help to enhance my community. I show up. You know, I have purpose today.
Thank you.
Is life perfect? No, because life, you know what I mean? If we're breathing, we got to go through things. But I get to participate in life. I get to participate in life. I am no longer a spectator.